Hi, Mrs. Mancini. My name is Cameron. I'm a level 2 nursing student at Conestoga. How are you today? Okay. Can I have your name, please? Okay. And your date of birth? Okay. And can I just check your wristband? Perfect. Okay. So Mrs. Mancini, we've done a bladder scan of your bladder, and it shows 630 milliliters of urine still left in your bladder, and you are complaining of abdominal pain and the need to urinate, but you can't. The healthcare team has worked out a solution, and we're going to insert a Foley catheter for you today. Okay, do you have any questions or concerns? Okay, so I'm going to just first off start by getting you into the dorsal recumbent position with your knees flexed at 90 degrees, and I'm going to put this underneath you, and this is just to absorb any fluids that may drip so that it doesn't soak right into your bag. I'm just going to put this under your hips like so. Perfect, and I'm just going to go back and gather my supplies, and I'll be right back. Okay, so I have here a size 12 Foley catheter for adults. You would want to use a size, I have a size 14. You want to use for adults a size 14 to 16, but you want to use the smallest size possible depending on the size of the urethra. But you want to use the smallest possible to prevent infection, trauma, and a lot of discomfort that may come with this procedure. So we will be using a size 14 Foley catheter, okay? So I'm gonna first start off by laying out my sterile field here. There is a 1 to 2 inch border on the outside of this paper. And I'm going to just expose genital area. And prior to putting in the catheter, I would take a warm damp cloth with some soap and wipe the outer labia from left to right and down the urinary meatus, just cleaning the perineal area before the procedure starts. And you can do that with just normal gloves. You don't need any sterile gloves for that because there's not really anything going into the patient, so you don't need sterile gloves and sterile objects for that. So I'm just going to lay out this on top of you to keep you just going to put this one right like that. Just going to discard these gloves for now. They technically are sterile, but we won't be using those gloves for this procedure. We'll be using the proper sterile gloves that have a proper fit for my hand. I'm just going to place this just to expose only the genital area, the area that I will be working with here, like so. Now everything inside here is sterile, so I want to put on my sterile gloves first, because my hands, if I start taking stuff inside that now becomes unsterile. So I am going to do hand hygiene. Open up my sterile glove package. And just slip on these properly fitted gloves. So now my hands are considered sterile, so I want to keep them above my waist. Anything that, if my hands fall below my waist, it is now considered unsterile, as your hands can bump into things and you might not even notice it. Okay, so this is a specimen container. We don't need to collect the specimen, so this will not be used today. This is a lubricant package which we will lubricate the Foley catheter with when we are ready to insert it. I'm just going to put that within the 1 to 2 inch border of my sterile field here. It is now still considered sterile. And these are cotton balls, which I will use an antiseptic solution to mix in with the cotton balls to clean the perineal area and sterilize it prior to inserting the catheter. This is the dark colored antiseptic solution that I was just talking about. This is a syringe filled with water, 10 milliliters, used to inflate the Foley balloon when the catheter is inside. Excuse me. Okay, so everything is in the sterile field set up nicely. So now what I'm going to do is I'm going to take the catheter and open it up, discard of the wrapper. Because my hands are sterile, I can touch this catheter, and I'm just going to place it inside like so. I'm going to take the lubricant, open it, not so nicely as you can see, and I'm gonna put some in there, and I will 2 to 4 inches, the tip of the catheter about 2 inches. You want to soak the lubricant on the catheter, so that insertion will be less, the patient will be in less discomfort. There'll be less friction this way, as well as it is a rubber piece of equipment, and the urinary tract is really sensitive, so this will help. So now my catheter, still sterile, is inside the tray, lubricated. So now what I want to do is clean the perineal area with an antiseptic solution. Here it is. I'm going to open it like so. Oops. Pour it over and soak the cotton balls. Like so. Comes with a green pair of tweezers. So I'm going to pick up these tweezers like so. They are still considered sterile until I touch the patient's labia. So just like a general perineal care cleaning, you want to do one stroke, left to right or right to left, and then down the center, going from the top towards the bottom. You don't want to go to bottom towards the top, as you might contaminate the vaginal area with feces. So you want to spread apart the labia with 2 fingers with your non-dominant hand. On the left side, single stroke, discard of the cotton ball. Take another cotton ball with the tweezers. The other side like so. And then right down the center. Like that. I cannot remove my hand as it is now considered unsterile. So with my sterile dominant hand now, I'm going to take the tip of the Foley catheter. First thing, remove this. I just moved it like so. You are allowed to move it like that. The inside is considered sterile, so you can pick the catheter tray up using the inside, like so. So using your dominant hand, you want to insert the catheter about 2.5 to 7.5 centimeters inside, or 2 inches, 2 to 4 inches inside the patient, until you see urine coming out of the Foley catheter. Just gonna move this a little bit closer. Are you in any pain or discomfort? And it's good to let the patient know too. Okay, so urine is now flowing out. So what I'm going to do now is uncap and because what's inside the Foley catheter that is inside is uncontaminated, this part of the catheter is not going to be going inside. So I can actually, with my considered technically non-sterile hand, I can grasp this just to help insert this fluid. So I'm going to insert slowly 10 cc's of water into the balloon. And it's always good to remember how much you take out, so that you can document that, so that whoever is discontinuing this catheter knows how much fluid is inside the balloon, how much needs to come out, because that can be catastrophic if not all of it is taken out and you proceed to pull out the catheter. So now I'm gonna just put the syringe here. So now the balloon is inflated, so I'm just gonna slowly, gently pull out until I feel resistance, like I do right there, and then just slowly push it back, like so. So the catheter is in place, urine is flowing out, everything is good. So now we're gonna hook it up to a bag if you want, well, you're gonna need to, because it is a Foley catheter, so we'll be in for longer than just to empty the bladder this one time. So to hook it up, you're gonna have a urine bag right here, and you want to attach to the patient's bed rail. And it is really important that you keep it below the patient's bladder, because it flows through by gravity, so it's going to flow downwards, it can't flow up. If it is higher, you will get backflow of the urine back into the urinary tract and eventually into the bladder. That can cause lots of problems, which we don't obviously want for this patient. She's obviously in a lot of pain and discomfort, so we want to try to minimize that. So what we're going to do here is we're going to just take the end of it. We're just going to simply hook it onto the end of this catheter, like so. Is everything comfortable? Are you satisfied with everything? Do you need anything right now? It's good to just offer assistance and just to see if your client is feeling any pain or discomfort. It is a very invasive procedure, so she might he or she might be in a lot of pain or discomfort, so it's good to just ask them if they are okay. So the urine bag is not touching the floor. You don't want it touching the floor also. Urine is coming out of the catheter, as you can see. Everything is closed. Now to empty the bag when it's full, or if it's getting full, you don't want it to overflow, because what it's going to do is it's just going to keep filling up and back up into this tube and eventually go back inside. So to empty it, you're going to want to gather your supplies first. You're going to want to gather a hat, a basin, or some sort of measuring container, because you want to measure urine output by the patient. So you just unhook it there. This is just to protect it from any drippage or anything on the floor. So right now everything is closed. Nothing is leaking out. To unhook it, there's a little clamp here. Push down like so. That'll pop open. Urine will be flowing out. Have your container ready. And to close it after, simply like that. Okay? And you want to put it back in there to prevent dripping from occurring on the floor. So that's how you empty a urinary bag and insert a catheter